determinant of autism. It led to the idea that the risk for autism was acquired in the womb. And that observation, I believe, was only in part correct, but perpetuated the idea that this was a disease which was contracted in utero and could not occur postpartum. And I think what it was telling us, rather than that the timing of neural tube closure and the insult at that time being crucial, what it was telling us is that the brainstem itself and factors which affect the brainstem, and they may be different, are very, very important in the evolution of autism. There's a very good paper, or a chapter that's just coming out from Woody McGuinness on this, neurotoxic brainstem impairment as a proposed threshold event in autistic regression, and I would commend that to you when it comes out. Now, going back into the history of autism, there are some very, very interesting clues. And one of those comes from the description of Mobius syndrome by Paul Julius Mobius in 1888. And what he described was a congenital disorder in children associated with facial nerve weakness, a disorder of brainstem development, predominantly of the motor nuclei of the cranial nerves, and children had odd facial expressions associated with this injury. And this is a cross-section of the brainstem. So if you took a cross-section through the brainstem, this is what you would see under the microscope. And this is the basilar artery that I've shown at the bottom here. Now, the nuclei that control those muscles that are involved in Mobius syndrome are largely situated up here. They are the 6th and 7th nerve nuclei. Muscles, the facial nerve here, and I think it's the abducens nerve here which controls eye movement. And they sit there, and that is a very peculiar region of the brainstem. That region of the brainstem receives two blood supplies. It is in what is called a watershed area of the brainstem. It receives a blood supply from these vessels on this side, the paramedian penetrating vessels, and also these blood vessels, the long circumferential vessels. Now, there is an evolutionary, a biological advantage to being in this area, because if one side of the blood supply is compromised, it is protected by the other side. So it has two blood supplies. But if the blood pressure in the mother or the fetus drops, then the blood supply on both sides is affected. And when that happens, it is that watershed area that is most compromised. It's rather like two retreating rivers, leaving an arid area in between. So when one side goes down, the other side can take over. But when both sides go down, say the mother has a placental abruption and loses a lot of blood, she drops her blood pressure, then the blood supply to both sides go down, and now that watershed area is critically perfused and is the first area to sustain potential damage. And so you see infarcts in Mobius syndrome in that kind of region there. Now, what is the cause? The cause of Mobius syndrome, in many cases, is known. And it is due to intrauterine exposure to drugs such as ergotamine, misoprostol, thalidomide, and cocaine, all of which compromise the circulation, all of which damage the formation or the performance of blood vessels. So ischemia, removal of the blood supply to the brainstem by these drugs, is a known cause of Mobius syndrome, fetal vascular insufficiency. And what is interesting is that Mobius syndrome is associated with autism. And there are several studies. 10 of 25 children identified by Johansson had autism. 5 of 23 Mobius syndrome had autism in this paper by Bandim. So Mobius syndrome is frequently associated with autism. But autism is rarely associated with Mobius syndrome. Does that make sense? I mean, you may have Mobius syndrome, and very commonly with that Mobius syndrome you'll have autism. But autism, who's heard of Mobius syndrome other than healthcare professionals in this room? 1 or 2 people. So Mobius syndrome, autism is rarely associated with that. But is there an area, is this the clue, is there an area of the brainstem that is absolutely critical for the development of autism? Is that the clue that it's giving at us? And that it's not fetal vascular insufficiency that is causing autism in the majority of cases, but something else about that area